Huntington's disease is a complex disease that progresses over a long period of time. In order to optimize care and to reduce impact, it is important to be surrounded with a good team that will support the person affected, the family, and the caregivers. Some of these healthcare professionals will be present every day, and others will be present more or less regularly. Here's a brief description of healthcare professionals. Neurologist. Neurologists are medical specialists who diagnose and treat diseases affecting the nervous system. Some neurologists are specialized in movement disorders and will know more about Huntington's disease and its issues. A neurologist can confirm if the physical symptoms have begun or not. They can evaluate the progression of the disease and refer the patient to other specialists to improve care. They may also prescribe medication that may reduce the impact of certain symptoms and optimize quality of life. In short, they coordinate the care given of the affected person. If the neurologist is part of a Huntington clinic, it is very likely that he's involved in different research projects on the disease. Psychiatrist. Psychiatrists are medical specialists in the treatment of mental health issues. When necessary, they may prescribe medication at the same time as another form of treatment. Among treatment methods, we can find psychotherapy, whether individual, couples, family, or group. Medications such as antidepressants and sedatives. Milieu therapy that refers to monitoring during hospitalization or during a stay in a center. Genetic counselors. Genetic counselors can help you understand how Huntington's disease can affect your life and the life of your family members. The counselor also provides support in decision-making regarding your health and your children's health. Counselors also act as educators and resources for other health professionals, as well as to the general public. A genetic consultation can also help you understand the medical aspects of the disease and research options. Topics discussed include disease inheritance, the risk for a family member to be affected, the availability of genetic testing, and reproductive options as to not to transmit the disease. Genetic counselors may also help you understand the impact of the disease on the affected person and his family, provide information on appropriate support resources, and identify strategies to discuss with other family members, such as siblings, spouses, and children. Occupational therapists help maintain independence and autonomy during everyday activities such as getting dressed, eating, and personal hygiene. They help adapt the living environment with the equipment necessary so that the person can live functionally and safely. Physical therapist. Physical therapists deal with the functional limitations caused by injury and disease. They work with patients in order to maintain their abilities and to prevent or delay complications associated with the disease. The type of intervention and exercises are adapted to the needs and the stage of the disease. Nutritionist. Nutritionists help maintain a good physical state in order to prevent other complications. If weight loss has occurred, they may prescribe meals with higher calorie content. They may suggest adapted meal plans and changes in food texture in order to reduce the risk of choking. Psychologist. Psychologists treat the patient or one of their family members by helping them work on themselves, their conflicts, their relationship, their trauma, their fears, and their grieving. The goal is to reduce or eliminate the patient's psychological distress.